Sandra all the time is here with the cold hard truth. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra. And
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth telling, more problem solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Good morning, everyone. Happy Tuesday. How are you guys doing this beautiful Tuesday morning? Hopefully everyone is having a fantastic day. We got lots of news to cover. Although we are having absolutely beautiful Caribbean weather, we're going to be thinking about our friends and family members in Florida who are now preparing for what is a massive hurricane, Milton. So you guys will know that by yesterday in the late morning, Milton already had gone up to Category 5 storm, which is shocking how quickly it intensified. So we'll bring you guys some of those updates here in just a second. So, let me just go ahead and get our Instagram folks on board. And then we're going to kick off the show because, of course, today is Tuesday. So you know what that means. It's learning time. And I know you guys love all the amazing information that we have to offer. And October is a very, very busy month in the health profession. I feel like there's always a lot going on. But the one thing that we always try to support, is obviously Breast Cancer Awareness Month. So we're going to be talking all about that here this morning as well. So give me one quick second to email everybody in the WhatsApp channel the links for this morning. Good morning to everyone on Instagram, Facebook, YouTube, and of course, Bobo 89.1 FM as well. Lots of radio listeners stuck in traffic. Sorry, but you got something to do while you're stuck in traffic. So fear not, we're going to be here with you, holding it down. So just give me 1 second, and then we're going to send out all the live links to everyone. So good morning to the WhatsApp channel. And some of you saw the post that we sent out yesterday. Miss Sissy Houston, who is the mother of the late Whitney Houston, passed away. She was 91 years old, lived a really good life. She was a singer herself, Grammy award-winning singer and mother, of course. And she had a 6-decade career that spanned all sorts of genres, including pop, soul, and gospel. So, another celebrity has passed on, but our condolences to her family. So, yeah, still lived a pretty good life, 91 years old. And you never really heard much about her. She was always kind of on the low key side. So Adrian joining us in the Philippines. Big shout out to the Filipino community. We've got some super fans in that community. We certainly appreciate your support. Thank you guys so much. I know that at the moment, a lot of you are waiting for justice to be served. We talked about it last week. And don't worry, folks, there's a lot that's happening behind the scenes in relation to this situation. So it is moving forward. And I think that justice will be served this time when it comes to Miss Mary Jean. We're going to keep the pressure on the authorities to, sort themselves out and to do their job first and foremost. Okay, so we want to welcome into the studio none other than Shamari Scott. We're hoping that Shamari has some good news for us on the football front this morning.
Hello, Sandy. Good morning. How are you doing?
Correspondent, he just doesn't know it. Good morning. Good morning. How are you?
Good morning, Kimana. Yes, I have some good news. I have my
Hey.
orange. So orange cup means a win. Blue cup will mean a loss from here on out. So we got a win, even though we're hobbled.
Yes.
We
Oh
managed to
my
get a
gosh.
win. So now we're only one win outside of being first in our division. So
Okay.
some of the other teams lost, so we got some help. So we're
Yes.
still in it. And obviously obviously for those that don't know, our star quarterback still isn't with us as yet playing because he's still out injured. But
Oh
hope
boy.
hopefully he'll come back soon enough, and we'll make that march towards the playoffs. So good
Nice.
news,
Nice.
good
Nice.
news, good news. And
All right.
also wanted to share with you with our prayers for Florida, because that's a very
Yes.
scary
Oh my
storm.
gosh.
And seeing some of the forecasts for the storm surge and how many
Mhm.
feet in certain areas it is, and it looks like the entire portion of Florida, the entire like panhandle and otherwise will be impacted. So
Yeah.
prayers. Hopefully, those that are told to evacuate heed the caution and actually
Mhm.
evacuate.
Yeah, absolutely. And we'll get an update a little bit later on in the show to kind of see where things are at, probably with the 8 o'clock update. But yeah, this is definitely nothing to take lightly. We encourage everyone to, just pay attention to the National Weather Service and all of your, your FEMA, all of your emergency services. We saw the line. Did you see that video that we posted with the, my apologies, the line of people who trying to get out of its way? And basically on the interstate, it was like one direction, it was bumper to bumper backed up for miles and miles and miles. And the other direction, which would be going into what could be the the worst areas, very few cars. So I think that's a good sign, because it seems like people are really heeding the warnings. Yeah.
Yeah. My father sent me that video before you posted it, so I was like, well, it's a good thing. Hopefully, the traffic flows freely, and everybody who wants to get out can actually get out.
Yeah, absolutely. And obviously, it's now a Category 4 storm, but that's still quite a bit. They haven't been impacted, in over 100 years directly in Tampa. So again, folks, heed the warnings for sure. All right. So thank you, Shamari, for joining us this morning. Always a pleasure to have you here, especially after a team win. You're always in fine spirits.
Yes.
We also have a special guest with us, Dr. Vinitha, who is joining us this morning as we engage in conversation about Breast Cancer Awareness Month. So good morning. How are you?
Good morning, Miss Sandy. I'm good, thanks. Good morning, Shamari. Good morning,
Good
Cayman.
morning, Dr.
As
Vinitha.
always, I'm very excited to be here in this show.
Yes. Thank you so much. It's always so wonderful to have you on the program. So this is a very, very important topic. We know that every October is Breast Cancer Awareness Month, and it's something that is very near and dear to my heart. I've had family members, both a sister and a mother, who have had breast cancer. And so, I think for women, this is one of those things that when it's brought up, it's kind of like it makes your heart kind of jump a little bit. You skip a beat, because, every woman and men as well should be thinking about the significance of this month and everything that we can do around educating people, as well as, encouraging ongoing fundraising for research support, because I think that one day we're going to have a cure, and maybe one day even vaccines in terms of prevention. So that's my ultimate hope. Dr. Vinitha, what do you know, before we start to get into what the sort of theme is for this year? What do you know on the research front that has been happening? Anything exciting? I saw some information a couple days ago that says, more women, there's actually a decrease overall, although there's an increase in younger women, which was kind of like, I wonder what's going on there. But what are some of the trends that the medical profession are watching currently?
Yeah, so a lot of progress is continuously happening in cancer research, and obviously breast cancer being the commonest cancer worldwide. I think it's an important focus of research and trials, and starting from prevention of cancer to detection methods, new technologies, and drugs. There's a lot going on all the time. So
Mm-hmm.
when it comes to preventing cancer, we are knowing more and more about cancer genetics. So
Mm-hmm.
previously we knew about only a couple of genes. Like for example, everyone knows about the BRCA, BRCA1 and BRCA2 genes that confer a risk for breast cancer. We now know that there are at least 18 other genes. I mean, and the number keeps increasing day by day. That can definitely increase your chances of getting breast cancer. So we know a lot more about who are at a higher risk of developing breast cancer,
Mm-hmm.
and starting from that, and now, so we know that, and that information is very useful when it comes to preventing interventions to prevent the development of breast cancer, first of all.
Mm-hmm.
And then high risk screening can be, kind of the patients at higher risk for breast cancer, they can have enhanced screening. And when it comes to screening methodologies, we have a lot of advances in mammographic screening, MRIs, PET scans that would help us to identify lesions which are quite smaller, and more precisely than we knew with what we had maybe about 10 years ago. We
Mm-hmm.
do have new types of PET scans for estrogen positive cancers, like there is a new F18 PET scan. And starting from that, moving on to drugs, we have a lot of, especially in all different kinds of breast cancers, we have new targetable mutations identified. We have new drugs like antibody drug conjugates, which are definitely helping our survivors live longer and better.
Mm-hmm.
So quite exciting to see at least the progress that we are making in terms of research and trials, and we definitely need a lot of money for that. And that's what one important aspect of the breast cancer awareness month is fundraising worldwide
Mm-hmm.
to put in more money towards research, so that,
Yeah.
as you said, one day we hope that most patients with cancer will survive this disease.
And
Yes.
Sandy, my mother would be upset with my manners. I know everybody. I think everybody knows Dr. Vanitha, and quite a lot of the community would know Dr.
Mm-hmm.
Vanitha. But it would be remiss of me to not introduce her properly. Dr. Vanitha is the medical oncologist
Mm-hmm.
for Pell City, Cayman Islands, but even more so, she's been the driving force for developing our oncology programs and all the different avenues to fill the gaps that otherwise you wouldn't have been able to gain access on island. When she arrived and she came and joined us, she would have been the first resident oncologist on island. So before that, there were people who would visit. You'd have visiting oncologists, but she was the first that would have been here full time doing what
Wow.
she does for us. And everything that you see, from the Gene Thompson Radiotherapy Center to very shortly with the PET scans and that whole program, would have been Dr. Vanitha, who is the driving force, who is showing the statistics, who is saying this is a gap that we need to fill within the Cayman Islands. So Dr. Vanitha is much more than what her title actually outlines, in that she is the person who, obviously from an education perspective, from very early, was talking about the importance of screening and doing a lot of volunteer work on her own outside of Health City, as well as pushing Health City to get a lot of the programs that we now have in place, as
Mm-hmm.
well as that radiotherapy center that has helped so many people in just 1 year. Dr. Vanitha, from day one, was outlining that was the next step that we needed to go to help the people in Cayman, but obviously from overseas to come in as well from a medical tourism perspective. So just want to thank Dr. Vanitha for taking time out of our busy schedule to be here to speak about it as well. But just to properly introduce Dr. Vanitha, who everybody
Yes.
knows and loves.
Thank you
Thanks
so
a
much,
lot.
Mari. Of course, we forget, because Dr. Vanitha has been on the program for a number of times, but we forget that we have new listeners who tune in all the time, who might not be familiar with some of our regular guests. So we appreciate the proper and formal introduction. As you said, you made your mama proud this morning. Dr.
Because she
Vanitha,
listens too.
I know. Breast Cancer Awareness Month for 2024, the World Health Organization Again, setting an initiative to reduce breast cancer mortality globally by 2.5% each year, saving, that might sound like a small percentage, but that's actually 2.5 million lives by 2040. So the theme this year is no one should face breast cancer alone. What are your thoughts about the theme for this year's Awareness Month?
Yeah, I think I was quite excited to see the theme for this year because I think this is one aspect that a lot of people, forget. We have to realize that the treatment of cancer doesn't start or end with chemotherapy, surgery, or radiation.
Mm-hmm.
So, a diagnosis of cancer changes one's life forever. And for a survivor or thriver, it is a journey which a lot of people don't understand that it's not a stop, event. It's a journey that takes up throughout their life. Their life is never the same again. And various cancer treatments, whether they have survived, they're still battling it. It involves, various, you have a life-changing side effects from the treatment, and which have a lot of emotional, physical impact on your life. Far-reaching impacts, which a lot of people don't understand. And so it's important that there is a robust support system for the survivors, apart from just the medical treatment that they need to survive the cancer. You also need the support of friends, family, the community in general, and even lawmakers. They have to, make sure that their country or their society has a support system in place to help the survivors. We like to call them thrivers. We don't want survivors anymore. We want them to thrive. And so, in order to thrive, we need to go beyond treatment. We really need to have help them go through or face or cope with the various emotional, physical, psychological, all aspects of cancer survivorship. So quite happy to see this being the title for this year, because it emphasizes what we need to do apart from treating a patient.
And of course, with breast cancer being the most common cancer for women globally, early detection, treatment, access, and emotional support being so important as key strategies for improving the outcomes. Community support, family support, all of the elements of that collaboration with persons in the medical profession, so incredibly important. So we're going to bring in a guest here as soon as she's ready to talk about what her journey has been like. She is you said not survivor. We're going to call them, thrivers. So let's go ahead and bring Jessalee, I think is how it's pronounced. We'll bring you into the program now. Good morning.
Yeah, good morning, everyone. I'm sorry I was late. I was on the road, actually.
That's okay. Welcome to the program. So good to have you with us. So do you mind telling us, as someone who's overcome a diagnosis such as this, tell us a little bit about what your journey has been like?
Once again, good morning. Well, the battle was initially a roller coaster for me. For Benita actually knows about that one. It's a glitch that as me sound. The falls were the physical pain, emotional difficulty, especially that I am alone. I don't have any family here aside from my workplace. So it was really so hard. After the chemo, I was only alone, doing everything. I even dragged myself to the center, which Dr. Pinoy told me not to, because I am going to endanger everyone, even if I'm going to say that, well, I am okay. I don't feel anything. Yeah. But the struggles, it's like, especially mentally, so struggles which almost made me want to jump off to escape. But the heights were the immensity, that support and that I received from, of course, my friends, my doctors, my oncologist team, headed by, of course, Dr. Binoy, which is very helpful, responsive, and everything. So basically, it was really a good support from them, not only from the oncologists, my friends, my bosses, co-workers, of course, as I mentioned, my medical team. support group, breast cancer foundation.
Mhm.
I received a lot of help and support from them, health city personnel, nurses, everybody. So, and then I even for those who are cancer survivors, strivers that that I met during the course of my treatment, each of them give me a ray of sunlight. They were
Mhm.
my daily dose, I would say, daily dose of medicine that made me stronger each day, make me have a positive view that everything's gonna be all right as long
Mhm.
as you have a positive attitude. Just say that it's only a part of your body. God
Yeah.
is there. Yeah. So as long as you believe in God, you believe that and claim that you will be okay, then that will be fine.
Mhm.
I also realize how I may have taken for granted for many things that I should have given more importance, such as my health. I'm sorry, I
Mhm.
actually went. So I was basically told during or last 2018 to
Mhm.
have a program, but of course because I was really scared, and
Mhm.
I said, I don't want to. I'm scared of
Mhm.
needles, scared of everything, but I should have to. My relationship with my family becomes stronger as well, not only with my son, but
Mhm.
with the Lord as well. My
Yeah.
health, personal well-being, my experience, and that I appreciate the real beauty, and it's going beyond
Mhm.
in the new normal. What is the beauty is with faith, despite the doubts, strained times of
Yeah.
trials and sadness, despite of the burdens. But I would say I am stronger. I
Miss
am.
Presley, can I just ask you a quick question? You said that it was 2018 that you received your diagnosis?
No, it was
No.
April 27, 2023. But when I had
Okay.
my medical checkup here, I was told to, or asked and recommended to do the mammogram, but I did not do it, which I should have.
So you're saying that you had a previous and just give us an idea of your age, because of course you look so youthful. It's hard for me to pinpoint how old you might be, but at the time that it was recommended for you to do additional testing. Was it just because you had reached a certain age, or was there something
Yeah, because I
that?
was 40 something that one. Right now I am 48. So
Okay.
yeah, he just said that you might as well go there because when you reach
Mhm.
40 it should be, but I should haven't, I
Yeah,
should
that's okay.
follow what the doctors told me.
Yes. Okay. All right. So just highlighting, of course, we're all human beings and we're afraid of different things, of course. So you're saying that fear of was it fear in your mind of a diagnosis, or just fear of, like, I don't know what that is, I don't want to do that.
Pain, maybe.
A pain. Okay.
Yeah, the pain,
Yeah.
and then aside from that one, I was also new in here in the island, and I don't have enough
Mhm.
resources that time when I asked
Mhm.
to that one. So my salary that time
Uh-huh.
is not as good as compared this time. So I
Yes.
just take it for granted. But
Okay.
yeah, I should have.
Yeah. So, Dr. Vinitha, this is important because these
Hello.
are things when we talk about community, that we need to have a clear understanding of how people respond to different situations differently. And there are reasons why people make certain decisions. So she says that there was a delay because she was
I don't
fearful.
know if you can hear me. Though. I cannot
Oh,
hear you at
yeah,
all.
we can hear you. So maybe just make some adjustments there. I'm just going to pull her out for a second while maybe she can sort that out. But yeah, we can hear you perfectly fine. So I was just saying that, we heard two very, very specific reasons, and I want to hone in on some of this because I think these are important things that prevent people sometimes from doing what they know they should do what the doctor is recommending. So, there is that sort of baseline exam that we get when it comes to breast cancer screening. Mammography is recommended for most people age 40, unless there's something specific to your family history or your personal history that might have a doctor suggest differently. But she talked about the pain. So let's talk about, for those of us who've done it, it's obviously uncomfortable. But are there new ways of handling women during the screening process, during mammography, that makes it less painful? Is there, better equipment? Talk a little bit specifically about that concern, so anyone who's listening this morning can put that to bed.
Yeah. Now, first of all, let me comment on Jessa. So she's been a true survivor, thriver in all the sense. She has done all that she has to do from her end to keep herself healthy once this diagnosis, and she had to really go through quite a few of the bad side effects of chemotherapy. But always smiling, always with a positive attitude, with her faith in God. I mean, she's been sailing through all her treatment. So I would like to thank Jessa for coming on today. But the pain related to mammography is a concern that most patients express, and for some it is actually a true deterrent from getting the test done. But one thing that I want to tell the audience is that mammography machines are so much more advanced now that the older machines the sensitivity of the machine was not great, so they had to really press the breast quite hard. So basically, mammograms are low dose X-rays of the breast, where they kind of keep the breast between two plates and compress on it and allow the rays to pass through it. So that basically had to flatten the breast tissue. So the previous machines were not so what you call sensitive, that they had to use a higher dose of X-rays, and they also had to squeeze the breast really hard. But what we have now is the newer machines have much more advanced technology. So we use lower dose of X-rays, and the breast compression is not so bad. I mean, it would definitely give rise to a little discomfort, but I wouldn't call it a pain. And I think the mammograms are always done about 7 days after your menstrual cycle, because when you do, especially in premenopausal, when we have to schedule it at a time when the breasts are less swollen, tender, because we all know that premenstrually you can have engorged breasts that will be more painful. So it's always scheduled about a week after. And more importantly, the technician who does the procedure has a lot to help make the patient comfortable. So the mammographic technician usually has to walk through the patient, about what is going to happen, and give them a kind of guidance as to say, okay, I'm going to do this now. It's going to be gentle, expect a little bit of this, but it should not be more. Let me know if you have any pain. I think that guidance is very important. And I think we do have good technicians in Cayman right now. And I've had personal experiences too, but, I think properly done. And of course, the person who refers the patient for a screening mammography, the GPs, you don't really go to an oncologist for that, but they can take a minute or so to explain what happens there and reassure them in advance, so that is not a deterrent for them. The worry about pain, because it is definitely not painful if done properly, with proper guidance. It is definitely not painful. Maybe a little bit of discomfort.
Oh, good to know. And then she talked about the financial component, which, I was just speaking to my husband yesterday about medical insurance, because he went to get some vaccines done ahead of some travel that's coming up here shortly. And he was surprised that insurance didn't cover vaccinations. And he thought, why aren't they covering more health and wellness components, prevention? Because the whole reason behind getting vaccinated is to prevent disease. And at that point, the insurance would have to kick in and cover those things. But if you can encourage people to do as much preventative stuff as possible, he's kind of thinking that insurance needs to step up to the plate and cover some of that. So, it is what it is. I mean, obviously, I think we need to lobby for better preventative coverage and more options available there, but there are some things available to people who are not able to afford screening if they don't have, sufficient insurance coverage. They shouldn't allow costs to prevent them from doing an annual mammography exam. So let's talk about some of the options that you're aware of on island that could alleviate the financial pressure if you need to get screening done.
Yeah, so insurance is so complex. You're very right, that nobody really understands what their benefits are, what the details of their plan, unless something, a serious illness happens to them. What most people don't know is that they're not aware of their wellness benefits. And most insurances have their wellness benefit covering at least a screening mammogram. I think this is what I learned after, my association with Cancer Society, that most insurance plans will have the wellness benefits will cover at least an annual or maybe once in 2 years a mammogram, which is a screening mammogram. So screening mammogram is done typically to detect cancer in people who don't have any symptoms. And this is what we want every woman over the age of 40 with a standard risk to have. And at least once in 2 years, they will be able to afford the mammogram that way. And if somebody doesn't have enough benefits to do a follow-up diagnostic test or a screening mammogram, then we do have, institutions like the Cayman Islands Cancer Society or the Lions Club of Tropical Gardens offering free mammographic vouchers. We at Health City, we do have our mammogram breast screening promotion programs at least twice a year, where we give out free mammography vouchers. And our machine is the latest, Xenograph Pristina, which is a 3D tomosynthesis mammogram. And we do offer give out a lot of free vouchers for screening in that machine. So we do have, people who are not aware of or who want to do a mammogram but don't have the finances for that can easily approach the Cancer Society or the Breast Cancer Foundation. So between these two organizations, we donate our free vouchers to them, and I'm sure the other hospitals in the country do too. So they can always approach these institutions to get their free vouchers.
Yes. And of course, Shamari, Health City Cayman Islands always offers various promotions. So perhaps this is a good time to mention the current promotion that's on for, senior checks and what Health City does on a regular basis to encourage people to do all of the preventative checks that they should be.
No, definitely. So throughout the year, we always target specific types of disease profiles and have screenings within the community. We try to get as much as possible into the community so that persons can have those types of screenings that you don't need to be in the hospital, but also to encourage people to come in. And as Dr. Vanitha said, we're quite generous with our mammogram giveaways in regards to the Cancer Society to make sure that if anybody needs to get a test, that they would be able to actually get that diagnostics test as well. But a little bit off topic, but however, still on topic in regards to screening. Just to remind persons that we have our senior health chat promotion. So this is for our more mature persons that are 65 years or older. And it's an assessment of your memory, bone health, balance, and continence. And it's a promotion that we're putting on that we're also giving in conjunction with our partner at ENT in Cayman, a free hearing test as well. And you have to book as well as take your appointments between October 14th to the 31st. And you can do that at info@healthcity.ky or 640-4040. And that's 640-4040 or info@healthcity.ky. And the price is USD $250 for your comprehensive senior health check, just to make sure that everything is as good as possible and to give advice where needed as well. But Sandy, I heard you speaking to, asking some relevant questions, with insurance, why don't they have more screening? Why don't they allow for more wellness, et cetera, et cetera? And I want you to put a pin because very shortly we'll be able to have that conversation about a product that actually is looking towards ensuring that individuals actually have those health checks. Because as you know, if you catch it early, the cost is less, as well as the
Mhm.
actual capabilities to be able to either cure and or give a better quality of life is much
Mhm.
enhanced. As well as if you catch things early before they actually start, you can also have lifestyle changes in order to make sure that you're around for your children or your wife or your spouse. So definitely excited about the fact that you outlined some keys,
Mhm.
and very shortly there's something exciting that we'll be able to discuss as well.
Yes. Well, thank you so much. I'm looking forward to having that discussion for sure. Because these are things that really do matter. We have Jean in the comment section. Jean says, my cousin was diagnosed with stage 4 breast cancer at 23. Wow, very young. She, her mom, and sister all tested positive for the BRCA gene. She underwent a double mastectomy, rigorous chemotherapy, and radiation, and opted to have her ovaries removed prophylatically. And like I said yesterday, I was diagnosed with lung cancer at age 43, having never smoked, and ended up having half of my right lung removed, in addition to chemotherapy, radiation, and immunotherapy. So, Jean, thank you so much for sharing those stories. It's very, very important, Dr. Vanitha, Jesse Lee, and Shamari, and everybody else listening, for us to normalize our stories around diagnosis and treatment, and even on the other side of it as well. I just had someone who's listening to the program say that they are on the other side now of a breast cancer and ovarian cancer diagnosis. So, we have to have these conversations, share these stories with each other, and that's also how we help to build the community to support people who've received a diagnosis. Not being afraid to have these very, very important discussions. So, Ms. Jessely, are you still with us?
Yeah, but my connection is not really good. I'm sorry about that one, but I am listening.
Yes, that's okay. As long as you can hear us, and then we can ask you a few questions. That's fantastic. So you were talking a little bit, if we could just return to your specific story, you were sharing with us some of the reasons why you kind of hesitated and waited. So when you had the recommendation to do the screening and you didn't, what then led you to the point where you got a diagnosis? Like, what were some of the symptoms that came up that made you think that something wasn't quite right?
No, I did not feel anything. It was actually March 6th. Yeah, I did not feel anything, nothing at all. March 6th, that when I put my seatbelt, I feel something on my right breast. So I said something is wrong. But I thought that because I still did not have my menstruation, so I've waited for 2 weeks. And then I went to see Dr. Puja that time, asking if what's wrong. And then right away, she told me to go to Health City and recommended me for biopsy and everything. But because my insurance was not really, it was my insurance were taking me for ever that time. So it took me a while to have my biopsy done. And then when I got it, I was just really, I don't know what to say. But then Dr. Binoy was the one who guided me, tell me everything. But honestly, I did not feel anything, nothing at all. Even during my chemo and everything, I did not feel anything. I haven't experienced vomiting, nausea, or anything like that. No, I did not. But
Okay.
no
So it was just-
symptoms, nothing
you
at all.
But you said you felt a lump, some sort of mass.
Yes.
Okay. And were you ever doing self breast exams?
Before, but then I stopped because it's like, for me, as I said, I took some things for granted. Busy with work. Yeah, so I never thought about it until that time. So that is why after I was diagnosed, I encourage everyone to really do a self-test. And
Yes.
once they reach 40, they really have to do a mammogram. It's not as painful as what I thought before. It
Mhm.
was actually very helpful. So yeah.
Yeah, very good. We have Diamond Princess, who says that for the past 2 years, she's been doing a mammography and an ultrasound. They said the ultrasound will pick up what the mammography doesn't pick up. So let's talk about, Dr. Vinitha, the difference between the two types of diagnostic tools and when it is recommended to add an ultrasound to a mammogram as well for screening purposes.
Yeah, so the mammogram is really good in picking up lesions in women who don't have dense breasts. That's why we prefer it for someone who is after the age of 40. Like that's when
Mhm.
the standard mammography screening starts. And by then, women's breasts are less dense. That means it has more fatty tissue rather than glands and all that. Because the breast composition it changes with time. So the breast tissue is made up
Mhm.
of glands. It's made up of connective tissue, what you call muscle and connective tissue, and we also have what you call fat tissue. So the
Mhm.
proportion of each of these components varies with age. So when you're younger, you have a lot of glands and you have less of fat. And after the age of 40, as your body goes through the hormonal changes associated
Mhm.
with age, your breasts become more fatty and then you have less glands. So if you have more glands, what you call fibroglandular type of breast, then the sensitivity of mammogram is not very good because everything will look like kind of white in the glands, and you cannot make out small
Mhm.
calcifications, small areas of tumor when you do mammograms for very dense breasts. So it's up to the mammographer. Like if you are younger than 40, then we don't advocate mammograms for screening. We advocate screening with breast ultrasounds. But even if you're over the age of 40, about 30% of women may still have fibroglandular breasts. And when they go for their first screening mammogram, the radiologist identifies the density of the breast and tells us, like the oncologist or the doctor, that
Mhm.
lady also needs an ultrasound. So
Mhm.
basically, we as doctors, we don't look at the mammogram images ourselves. We rely on the radiologist who give us a score. I mean, many people who have done mammogram will find what you call a BIRAD score in their mammogram,
Mhm.
0 to 6, and this score tells us whether you need an ultrasound in addition to mammogram. Is it suspicious? Does it need a biopsy and stuff like that? So we
Mhm.
use that information. So if in your mammogram report you find BIRAD 0, a score as 0, that means you need an ultrasound in addition.
Mhm.
Sometimes we'll need to follow up with an MRI as well. So
Mhm.
these are the three imaging modalities we use in breast cancer: so mammogram,
Mhm.
ultrasound, and MRI. And as I said, for younger women, we prefer ultrasound or MRI. Older
Mhm.
women, mammogram, yes, but maybe need to be topped up with an ultrasound or an
Mhm.
MRI. So the radiologist who does the mammogram will let us know whether we need any additional ultrasound. So
Mhm.
ultrasounds, as you know, is just passing sound waves to the breast tissue. It
Yeah.
is not radiation, and MRI uses magnetic waves.
Mhm. Okay, very good to know. And a couple months ago, I was reading some very interesting sort of emerging research about the possibility that technology, artificial intelligence, can also help in the fight of diagnosing breast cancer. There was a study that was done in the UK where artificial intelligence picked up on some breast cancers that had been missed by the human radiologists. I mean, obviously they're human, and they might miss things. So, what do you think? I mean, what are your thoughts about how the advancement in that sort of technology could add an additional screening layer to helping diagnose more? Because obviously, early diagnosis is the key here, right?
Yeah, that's for sure. And AI is making leaps and bounds of progress in diagnostics. So what basically it does is, for an AI program, they can evaluate or go through tens of thousands of mammographic
Mhm.
images and store it in their information system or whatever. While a radiologist, even if trained specifically for mammogram, can probably go through maybe about thousands in their lifetime. So
Mhm.
what AI can help is enhance the capability of the radiologist to diagnose lesions that could possibly be kind of suspicious. Even the most experienced radiologists may
Mhm.
find it hard to tell what a lesion is like looks like, and the use of AI technology can help the radiologist in telling us what to do. So
Yes.
definitely that's going to be an important advance. It's never going to replace a radiologist, but definitely going to enhance our capabilities of detecting smaller lesions and more, what I call broad lesions that may not look very suspicious. So definitely yes.
Yes, very good. And humans are subject to fatigue and other things that AI would not necessarily be a concern. So let's now talk about some of the areas in which people can be supported. Again, sort of staying focused on the theme for this month's breast cancer awareness, all about community support. There's emotional support, practical support, and medical support. Let's break those down a little bit about what is covered. And Jessie, you can jump in at any time about how your community. You've talked about the fact that your family rallied around you, your church and your faith being so incredibly important to you. There's practical, driving to appointments, navigating insurance, and trying to figure all those things out. So, Dr. Vinitha, which of these would you say is most important for your patients that you've seen here in the Cayman Islands? Are they all equally important, or is there some areas that you find right here the emotional support element is really, really lacking, and that's where we need to step it up more?
I think we are doing a great job in our small islands. Definitely, when compared to what I have seen elsewhere, I think the whole community comes together. And what I tell my patients often is not to keep everything to themselves and suffer alone. I mean, there are a whole lot of. I mean, I think every one of these. We have the facility in our islands currently to attend to each and every one of these issues. Like from what Jessie had to go through in terms of financial help. The Cayman Islands Cancer Society or the Breast Cancer Foundation will help or does help us all the time wherein there is somebody with a strong suspicion of cancer and needs a biopsy. So we've not just breast cancer, lung cancer. We seek that help quite often when the initial diagnostic benefits of a patient has been exhausted. We do need help with that biopsy. And if the biopsy, clinically, there is a high suspicion of cancer, they ask us, do you think this is cancer? Then we will help. And I tell them, yes, this looks most definitely like a cancer and she needs a biopsy. And they do help us a lot. I mean, with all this. So that's something maybe Jessa could have got at that time, would have helped with her with a biopsy earlier if she knew about this. But obviously, at every point, even financial support is an important aspect that most people ignore. I mean, and if the financial aspects are not addressed, it leads to a lot of psychological suffering, emotional and psychological suffering.
Yeah.
So I think we do have that resources abundantly in our country, thank God. And then the Breast Cancer Foundation with their wellness program, the Cancer Society with their screening promotions. I think everybody goes a long way. I mean, all these organizations, and I must commend the Lions Club, who have been pioneers in mammography screenings. So I think overall we can bring everything together. We may not have everything under one roof, yes, but all these different organizations work very well together. So there is support available, any kind of support. I think we just have the patients, the survivors have to just seek it, like ask for it.
Yes.
Yeah.
Jessie?
Yes, ma'am.
Yes. What did you think for yourself when it comes to emotional, practical, and medical support? Was there any one of those that kind of stood out as being more important for you, or you think they're all sort of equally as important?
I would say equally important. Financial, emotional, physical support from other groups, especially from the Cancer Society, Breast Cancer Foundation. Based on my experience, they had helped me a lot. These organizations helped me a lot, especially when I went to like emotional breakdown. So they were there to support me. Blessings, more blessings, even after, before I went home to the Philippines for vacation. Everything, every possible means to help me mentally, emotionally, physically, financially, they were there. So I would say equally importance. Yeah.
Equally important. Very good to hear.
And I
Um,
also have to comment on the community support, right? And the family and community support. I think the family structure of Cayman is such that, everybody is close to each other. There are still extended families around to help, and friends rally around. And of course, we have to remember the church, the most important community, offering, financial support, spiritual support, emotional support is their faith. So that
Yeah.
that also goes along towards healing, like holistic healing and the wholesome healing of our
mhm,
survivors.
mm,
Yeah, I agree with Dr. Ravidoy. Spiritual help. I
mhm,
am very blessed to have a family here in Cayman. I would say not by blood,
mhm,
but by relationship, especially the Saint Ignatius priest and some other people who were
mm,
there, who supported me all the way since I started. From the day that I was diagnosed, they were there to help
mm.
me, pray for me, and everything. So yeah,
Yes.
spiritual is also, it's very important.
Yes, absolutely. Um, and this can obviously, having the right kind of support helps to reduce your anxiety, the stress that you're going through, which can be tremendous at a time like this. And also encourages patients, Dr. Vineet, I'm sure you can speak to this, to really stick to their treatment plans, stick to their appointments if they have someone who's there to assist them with, the practical stuff as well.
Yeah, so one of the most important, as Jessa mentioned in when she spoke about her experience, is transport, right? You know what? So even the smallest things, getting someone to drive them or drop them to the treatment center, get them
Mhm.
back, get them some food when those days when they're not able to get up and cook for themselves.
Mhm.
I think all that goes a long way. um, uh, and there are some other things that we have that we've been very blessed to have in Cayman, like the scalp cooling system, the cold
Mhm.
capping that the Breast Cancer Foundation has given us way long before even the centers in the
Mhm.
US were using them. So I remember in 2017 when we started, or 2016, we got our first scalp cooling system. The centers in US were against it doing that, and they were
Mhm.
not offering it at all. But now, if you see, everybody is offering it, and they have even insurance pays for it in some centers. So I think we've been blessed to have that long time ago. And I think all this goes a long way in improving the quality of life of
Mhm.
our survivors.
Mhm. Yep, absolutely. All right, folks, 936-2626. Don't be shy. We'll take your calls as well. If you have any questions or comments for our listeners or special guests this morning on the program, there's a number of breast cancer support entities right here in the Cayman Islands. So perhaps this is a good opportunity to talk about some of those so that people will know exactly, what options are available, where they can reach out, perhaps outside of their immediate family as well. So we have everything from obviously the Health City Cayman Islands team offering state-of-the-art diagnostic and treatment services, oncology consultations, intervention, and chemotherapy. We've got the Dana Farber collaboration. So tell us a little bit about what that's all about.
Yeah, so as Dana-Farber Cancer Institute is in Boston, and
Mhm,
it is considered the mecca of cancer treatment, because that
mhm,
is where chemotherapy evolved as a medicine or a
mhm,
modality of treatment of cancer. So the first chemotherapy was given or envisaged or developed by Dr. Sidney Farber, whose name is there in the institute. He treated developed a drug for leukemias, and that's how the journey of cancer treatment started way long back, more than a century ago. So
mhm,
it's one of the top three centers, cancer treatment centers, not just in the US but also in the world. And since last year, we've been very privileged to have this collaboration with this esteemed institute, whereby we have access to expert advice on
mhm,
complicated cases, all kinds of cancer. And we have their experts coming down and holding CME programs for the local physicians. We have tumor boards with them where we could present our challenging local patients and get their
mhm,
advice. We've had several virtual consultations with their team for various complex cases when we need, like, for example, we need an opinion on someone who has gone through all kinds of treatment and we are looking for something else, or maybe a clinical trial or the next option in the pipeline, so that our team is kept abreast on all the developments. We can bring all that to our people in the Cayman Islands. And we also have what do you call, clinical training programs with them. So I've been, and even Dr. Vikas, our radiation oncologist, was up there in Boston this summer doing observerships. And we had that opportunity for 4 weeks every year so that we can go and observe their team, various departments, and keep ourselves, updated on what is new in the world of cancer. So this collaboration has been extremely, helpful to our oncology services, and we look forward to more and more, events with their institute. And now we have an option of getting these virtual consultations with these top experts in the world. It's quite easy to arrange and no hassles usually. And we are offering, even getting genetic counseling. We talked about BRCA screening and all that. So we can do the pre-test counseling. We can get their panel of tests done there. We can do the post-test counseling. Several of these things were not available in Cayman before. So through our collaboration, we are able to bring much more advances to the islands, or access to these advances.
And just to mention, Sandy, if you're in the medical field, then obviously, or if you've had to visit Dana-Farber, then obviously you understand the quality and the name. For those that are non-medical, just to mention that Dana-Farber Cancer Institute is the principal teaching affiliate with Harvard Medical School. So I know most people would know Harvard and would understand the quality behind Harvard. Just wanted for persons to understand that that's the main affiliate for the teaching that occurs with Dana-Farber. So Dana-Farber and Harvard go hand in hand. And also to mention that, and this is a testament to Dr. Vinitha and her team, Dana-Farber doesn't affiliate with just anyone, right? They're going to affiliate with another quality institution that they believe meets their standards of excellence. So the fact that we have this affiliation also speaks to, outside of all the other modalities that we have, that from an oncology and a cancer perspective, we're at that level to allow for that affiliation. So a different program for a different time that would speak to all the various types of cancers that would be able to deal with. But this also is to give comfort that for the small percentages of cancers and specialized treatment that we may not be able to offer, we have that fallback affiliate of one of the best cancer institutes in the world that we would be able to refer to if needed. So that just gives an additional layer of comfort, knowing that Health City is filling those gaps when it comes to a cancer perspective.
Yes. And of course, there's so many amazing organizations. Cayman Islands Cancer Society, who does everything from free mammogram vouchers, financial assistance, counseling services, and of course, advocacy for breast cancer patients. We have the Breast Cancer Foundation of the Cayman Islands. They offer educational programs, early detection initiatives, and financial support as well. And anyone who's interested in donating, volunteering, by all means, you can reach out to these various nonprofit organizations who are doing amazing work. And I would like to do a big shout out to the Lions Club of Tropical Gardens, who every October really steps up to the plate and does an amazing job with breast cancer awareness. And encourage all of you. They're having everything from on the 25th, their dress down event, and a number of calendar events. So we'll put them on our community calendar. You can check our website, caymanmallroad.com, for all the details of the different events that they're having through the year and through the month, my apologies. And you can visit their website, which is lionscluboftropicalgardens.com, for additional information as well. So lots of amazing things happening in the month of October around supporting and educating people when it comes to breast cancer awareness. Of course, men, don't think that this is just something that the women in your life need to be aware of. You know, men can get and have been diagnosed with breast cancer as well. So please pay attention to any lumps or anything unusual that is happening with your body. Mm-hmm. All right. So, Shamari, just to kind of wrap up here, we've got the senior health check promotion that's on for anyone who is 65 and older. I was just sitting here thinking to myself, I need to come in and do my annual mammography. So I'm going to try to do that maybe next week. My mother-in-law is coming. So, of course, she is in the 70 plus category now. So I want to encourage her to get all of her, health checks done on an annual basis as well.
Awesome. So so Sandy, we had mentioned before, but we'll do it again, so that those that may have tuned out for a second will hear. But we're offering a senior health check promotion. You can book between October 14th and 31st. It includes an assessment of memory, bone health, balance, continence, and we will also have a free hearing test with ENT in Cayman, and it's all for a reduced price of US $250. And obviously, if we need to work with you as well, just give us a call and or email us, and we'll also work to help to make sure that all of our more mature persons can gain access to this health check screening as well.
Yes, Miss Lucille enjoying the conversation. She says a very good topic this morning. God bless the staff at Health City. You all stay safe and lots of blessings always. So, Jesse, can you tell us where you are currently in your journey with breast cancer?
Right now, as Dr. Benita had told me, that I am a cancer free, but I'm still doing treatment. Every month I had injections. I had bone straightening, which I am going to do the injection when I come back to Cayman Island very soon. But so far right now, I would say I am not just a survivor, I am a thriver. And I am happy that I was under the care of Dr. Binoy, who had helped me a lot, encouraged me, and do everything. Very responsive, very helpful. And so, yeah, I would say I would encourage everyone, especially both young and more than 40, to do a mammogram, had a regular checkup.
Thank you so much for that. Someone does have a question. One of our listeners says, what are the benefits of scalp pulling? Hadn't heard of this, but she's saying that many places are offering it now. And this, she's wondering what were the benefits of that.
Yeah, so one of the most distressing side effects of chemotherapy is that the hair falls out, right? What you call alopecia in our language, but hair falls out, and that's very, very distressing for anyone to go through, especially women. So it's kind of it destroys their self-image, their self-respect. Then when you have young children, and it's a very, very kind of thing that no one wants to go through. A lot of people even avoid chemotherapy for fear of the loss of body image because of alopecia. So I think scalp cooling is something that has been around for some time now, which is a very safe method. So basically, you freeze your scalp, not your brain. Okay, it's not brain freeze. So you're just cooling your scalp to an extent, to a degree that the chemotherapy doesn't reach your hair follicles, and it doesn't destroy the hair follicles. So you keep caps, specially designed caps, or there's also a scalp cooling machine that will circulate, that you keep wear around your head, and it circulates cool air through the machine. So it freezes your scalp for the time that you are doing chemo, and that prevents a chemo from reaching the scalp. And it's got for various regimens, it's got variable success rates. For some of the strong regimens, it's not that great, but for some of the most regimens of breast cancer, there will be at least a 60 to 70% chance of preserving your hair, or at least avoiding a complete, baldness. So I think it's been very reassuring for a lot of our patients to have that option. It's a choice, of course, but a lot of people try it, and most people go through it, and successfully, I would say. And the Breast Cancer Foundation and their volunteers have been instrumental in helping us. Our team offer this to our patients. So I offer it to everyone. I mean, who I think has at least a reasonable chance of keeping their hair. And I must say, not just women. Last year, I had a man, for the first time with prostate cancer, and he was adamant that he won't go through chemo unless he has this. And he went through this, and he was left with his beautiful shock of hair that was mop of hair he was very proud of. That he didn't want to lose. So not just women, but men have also used this. And I've had a very young, vibrant, girl who was off to college soon, didn't want to lose her hair, not a breast cancer survivor, but she did that, and she was left with beautiful locks of hair after her chemo. So all these success stories, make us very happy to have this option.
Very well.
I use it.
Yes.
I use it. Dr. Abidoy actually told me that I'm going to have like 30% chance to have my hair, but I told her that 30% is better than nothing. So I use it for maybe until my 6 or 7, but then I decided to stop it.
I think Jesse might have dropped out there. Some internet issues. I think she is. She did mention that she's outside of the Cayman Islands, so the internet might be a little bit spotty. But it sounds like she had a favorable, experience with that as well. So very good. So thank you so much to Jesse. We appreciate you sharing aspects of your story with us. We want to thank Dr. Vinitha, of course, for joining us here to discuss this very, very important topic, folks, all about breast cancer awareness for the month of October. And of course, Shamari Scott, as always, here holding down the fort for Health City, Cayman Islands. So Shamari, let me ask you before you leave now. Yes. We know that the facility there at Cayman Bay is opening up. Are they going to be able to do mammographies? I saw the equipment in place, but are they going to start doing mammographies now, or what is the position as it relates to that type of screening? Are you guys ready to rock and roll as yet?
Let me check to see when the phase for the mammography is supposed to start. However, once we start, every phase will take another week, so it will occur within the month of October. I just need to see which specific week that section will be ready. Yes. So you've given me some homework, so I'll definitely have that for you when we come back on next week.
Sounds wonderful. Yes, because you guys reminded me that I got to get in there and definitely get mine done as well. So thank you guys so much, Health City, Cayman Islands, folks. 2 amazing locations. I know a lot of you saw the preview video that we did of the Cayman Bay location. Beautiful, but Health City is also there if that's more convenient for you. Lots of similar people. Some of the physicians will do a day or 2 clinic at Cayman Bay, then they'll be at East End. So Jesse, let's just bring you in one final time to say thank you so much for coming on the program and for helping us to see the faces of breast cancer thrivers and to really normalize the conversations around it. And we're going to continue to pray for you and wish you success in your journey.
Thank you so much. And thank you for having me here as well. I do appreciate.
Yes, absolutely. Thank you.
I'm so sorry with my connection.
No, that's okay.
But thank you.
Yes, thank you. We appreciate it. All right. Thank you guys so much and have a beautiful day.
Thank you.
All right, folks. Another wonderful segment there. And just like that, we've got a caller in the line. Good morning, caller.
Good morning, Miss Sunday.
Good morning, honey
all of your guests.
They just stepped out of the studio, but I think they're still listening.
Yes, I just want to say that lately, for probably the past 6 months, I've been going to Dr. Terran at Cayman Bay, And I want to I know you're talking about breast cancer this morning, but I want to give a shout out to him. I'm going to tell you why. I went to him. He sit down, he talk with me, and we come in like two buddies, two peas in a pod.
Okay.
And I'm not afraid to talk to him or say anything at all to tell him. But I want to say that health today, I want to encourage people to go, because Dr. Charon emails me, he follow up with me, he calls me, he make appointments and call me and to check on me to find out how I'm doing, which I've never had before.
Wow.
And I'm just overwhelmed by the treatment that I get from him. When I have to get refills, he write it and he call his nurse call and say it's ready. You can pick it up anytime. The thing about him calling me and checking up on me, that I don't have to go in every month or every 2 months or every week. He called me and check on me to find out how I'm doing. If he give me homework to do, I do it, and he call and check. So I just want to encourage people that is the place to go, because they care about you. That's my 2 cents for this morning, Sunday. You have a wonderful, blessed, and productive day, my dear.
Uh-oh. Looks like I forgot to unmute myself. My apologies. No, I was just saying that has been my experience as well, just as wonderful as that caller. But what I find happening sometimes is people say, oh, but Sandy, you're going to get this amazing experience just because of who you are. So it's so wonderful to see that it doesn't make a difference who you are. All of you, are able to get the same amazing experience. When I go for my appointments, I get the follow-up WhatsApp messages from the physicians to say, hey, how are you feeling? Want to make sure the medication is working. A day or so into taking something, they always check in and see how things are coming along. And if you're not feeling better, they want to try, something different to really try to give you some comfort. So thank you so much to that caller for that amazing testimony. Folks, I'm having oatmeal for breakfast this morning. We're going to go healthy. Tuesday, healthy options. I was just about to have it, and then I thought, oh my gosh, it's been sitting here and it's gotten kind of cool already. So I'm going to warm it up again. All right. So listen, we've got a couple of things that we need to discuss on the political front. Whoop, whoop. Y'all ready? All right. Give me 1 second. I'm going to beg Miss Stacy to help me warm up the oatmeal, because you know what Aunt Lottie used to say? Start your mornings off with a good hot something on your stomach, honey child. Start the mornings off just right. And especially for this discussion, we need to make sure we got our strength, because it's going to take everything, everything called strength to get through the rest of the program today as we talk about politics. All right, give me 1 quick second, folks. Gonna heat up my oatmeal and I'll be right back. All right, honey chillin', what's going on? Good morning, beautiful folks. Good morning to all my people. I sound like somebody else when I said that just now. Yes, pun intended. Y'all know who I'm talking about. That's my little friend Kenneth. when he talks about his people. Listen, everybody's my people, though. I don't care who you are. Listen, we had some interesting conversations yesterday. Let me just say this in relation to landlords and tenants. I had somebody else message me this morning saying, oh my gosh, Miss Sandy, landlords need help. I know tenants need help. It's just crazy, really, what is happening in this country. I think everybody needs help, and that's why there's a really, really good argument for why we should put something in place, like some sort of a tenancy board that can help sometimes with some of these disputes. I had someone yesterday listen to this question, and I think it's important for us to educate people about, what your lease says. It's important that you read your leases, you understand what you're supposed to do and what you're not supposed to do. So I got the following question yesterday. Let me just try to see if I can find it real quick. Someone was basically saying that their landlord gave them notice. And so they were wondering whether or not, this was for their friend, whether or not they had to continue paying the rent. So this is what it says. It says, good night, Sandy. This was yesterday. My apologies for messaging you at this time of the night. I wanted to ask you a question. If someone is renting a place and the property manager gives a person eviction notice to come, do the person still have to pay them the rent for that month? So I said, well, what does the notice say? Like, what does it actually say? They say, and give me the dates that they have to leave. So it says it was written up on September the 3rd, 2024, and it was given on the 4th. And it says that they have to move out by October the 31st. Okay, so the first thing that you always do, let me clarify how this works. There is some sort of a landlord law, not a very good one. There is something that is in existence. It's not particularly good, but I suppose some people argue that it is better than nothing at all. So what you should also make sure that you have in place, though, is everyone should have some sort of a lease agreement. Just like a contract of employment, the lease agreement will lay out the terms of how you and the landlord, so if you're the tenant or you're the landlord, how the two parties will work with each other, what the notice period is, what the rental amount is. It's going to have some basic things in it. Some contracts are more complicated than others. I mean, you can have tenancy agreements that are all 30-page long, depending on, what it is. Commercial properties and so on can be a bit more complicated, but normally that will set out some of the basics of what's expected of you as a landlord or tenant and vice versa, right? So the good news is when you have a contract in place, you should always have a look at that contract. What does the contract say? Mm-hmm. Now, in lieu of if there's no contract in place, then we resort to sort of the common law, and we look at things like, what does the common law say about notice periods, et cetera, right? But try to keep it in writing. That'll help to alleviate a lot of your stresses in life. So in this situation, this really isn't an eviction notice. And, I know the person said eviction note, but a lot of times people will confuse terminology. And this isn't really what an eviction notice is. Your lease agreement, just like your employment contract, gives people the opportunity to make an exit. Like there should be no contract really that you sign or that you enter into that you can't get out of. That would be unconscionable in the democratic world, so to speak. That would be tantamount to, if it was an employment contract, it'd be slavery. So I find it interesting when people say, oh, my helper wants to resign or leave or whatever. And I'm thinking, what do you think? The person has to stay with you forever? Mm-hmm, honey child, look at my healthy oatmeal. Mm-hmm. Mm. My aunt would be so proud to see me eating my oats this morning. Nice and warm. Oats are good for your tummy, good for your digestion. So yes, of course, people can exit contracts. That's ridiculous. Just like you don't have to continue working for someone forever, they can give you notice. It really just comes down to how it's done, not the fact that it's done. And how it's done does matter in law, because if people don't give you sufficient notice and whatever payouts you're entitled to, then that's where it can become a problem. Same thing with landlord tenancy. A landlord doesn't have to give you a reason, to be honest, why they need you to vacate their property. It could be any reason or no reason at all. They could just be like, you know what, I'm going to do some renovations. They may tell you, they may not tell you. It's unfortunate in this jurisdiction, however, that we don't have any protections in place. So in other places, other first world countries, there are some protections. So you can't evict people or give them notices to vacate your property for discriminatory reasons. So you can't discriminate against them because of their, what they look like, who they are, Caymanians, Jamaicans, expats, whatever. You shouldn't be able to discriminate based on any of those things, race, color, creed, that sort of thing. We don't have any of those protections in the Cayman Islands, honey child. We're waiting for some sort of consumer protection, because those things would be great. There should be anti-discriminatory legislation, even as it relates to employment. Those things just don't exist in this country. So when I see people saying, oh, they want a nanny that's a Filipino, or they want a nanny that's a Jamaican, or, whatever. Although it really irks me a lot, I recognize that legislatively there's probably, they can do it. They shouldn't be doing it, but they can do it because there's nothing in the law that says you shouldn't do it. And so this is why legislation is quite critical. So someone gives you notice. They're supposed to give you 30 days. So the only kind of caveat I would say with this question that I received is, and the question really was whether or not she has to pay the month of rent, which would be the last month. The short answer to that is yes, you have to pay the rent. So when someone gives you notice to vacate, that doesn't mean that you get the last month for free. Some people think that because they have a deposit on hand, the deposit then covers the last month's rent, but that's not what a deposit is for. A deposit is to be returned to you in the event that there aren't any damages, but the deposit is specifically for damages to the property. So it's not for your last month's rent. So if you're giving notice and you're going to come out of a property, you can't say, oh yeah, use my deposit as my last month's rent. You have to pay that last month's rent, and because you're still enjoying the peaceful use of the property, in this case, up until October the 31st. Technically, they haven't given a full month's notice, because I'm sure the contract says a full month's notice. So that's the only thing that I would say. Obviously they're ending it at the end of the month, but they should have given notice on September the 30th or 31st. I don't know how many months or how many days are in September, but it should be a full 30 days notice / month that was given. So they gave it on the 4th. So really and truly, you should have until November the 4th to be able to vacate. All right. So that's the only thing. And it may not matter to this person whether they stay until the 31st or the 1st. But if it does, because, you need extra time to look for a place, you can certainly write back to this person and say, thank you for your notice, but subject to our lease agreement, or in lieu of a lease agreement, if there is no lease agreement, you can say subject to the common law provisions, a month's notice, because you pay on a monthly basis, is what is required by law. All right, honey child. But you still got to pay. Okay, so somebody says they want to email me. tips@caymanmallroad.com is the email address. All right, inspiring. Good morning. Says oats is good for your cholesterol too. Thank you so much, honey chow. Luckily, that's never really been something that I've ever had any issues with. I've been blessed with pretty good cholesterol over the years. As you get older and you put on more weight, it does creep up a little bit. But I've always had, I remember, child, in my 20s and 30s, my cholesterol was very, very good. But remember now, it's not just the cholesterol you're looking at, folks. You got to look at the triglycerides and the ratio of good to bad cholesterol, not just the total number. I'm an amateur doctor in my spare time. All right. Rebel says, what if you find out that you're going on rollover and they owe you rent? So find out they're going on rollover. All right. So listen, this is the other reason, Rebel, why you want to have things in writing. And because we have such a transient population here, what I would recommend to any landlord is to ask the questions related to just like how they have to tell immigration where they're staying, and they're supposed to be able to put down your address, and you actually have to fill out an accommodation form. Don't forget. You guys, a lot of you be moving here, there, and everywhere, and none of you are updating your accommodation forms with WORC. That should be done. So, wait a minute. Did I say September? Did I have my dates wrong? Oh, my apologies. September. Oh, yes. My apologies. Good catch. Good catch, Christina. My math was off there. Let me just verify. Oh, yes. No. Right. That's right. So that's more than sufficient notice. Yeah. So that's fine. So they've actually given them additional notice. So, yep. Thank you, Christina, for catching that. You're right. My brain was thinking October the 4th, really. And then the 31st wouldn't have been a full month, but you're right. That was September. All right. So, you have a right, Rebel, to ask the question if your tenant is someone who's on a work permit ahead of even the agreement being entered. When is their rollover, so that you have that information for yourself, because that makes a difference. If someone's coming into rollover, they're supposed to know their term limit dates and stuff. Immigration gives you that. You should know exactly when it is that they're going to be rolled over, right? So having said that, I would simply have asked the question at the time that they entered into the lease, and make sure as you get closer to that date, everybody is fully aware of what their obligations are. This now is why you find some landlords feeling like they have to take first month and last month's rent, because people who are going over and rollover, who are leaving the jurisdiction, they have an easy out of being able to skip out on you, and then you don't get paid that last month. So, talk to your tenants. Always have good open lines of communication with them, and ensure that they know that last month is not your deposit money, that you have to still pay it. And just as they would expect you to return their deposit money, they should be expected to pay their last month's rental as well. Good morning, caller.
Morning. I see it from both perspectives, because I personally have been on the tenant side of it, where I left, paid all my rent. Like, as a matter of fact, I was on a scholarship at the time, and coming from Kim and Brat, when you come over here to school, you get assistance with housing, or you used to. I don't know if they still do that, because I didn't have family here that I could stay with. And so I would get a check for 6 months at a time. So my rent was paid 6 months in advance. And when I left, I was there for probably at least 2 years. And when I decided to move out, the lady was like, okay, I have to do an inspection, whatever, before I give you back the deposit. And I said, okay, fine. And when I left, I got a cleaning company to come in and clean everything. She called me back and said the place wasn't clean. The bed was broken, which a part of the bed, like, those cheap beds where underneath has the, like, only one piece of wood or whatever. So that middle piece of wood was broken, which I consider to be wear and tear after 2 years. Wear and tear. But even if she had to replace that piece of the bed frame, right? Anyway, she came up with every excuse under the sun not to give me back my deposit. So I can see where tenants feel like, I'm just not going to pay the last month's rent because they're probably going to keep my deposit anyways.
Mm-hmm.
So they'll just say, okay, keep the deposit, right? And I won't pay the last month's rent, which I can see from the landlord side, because if they actually did damage things in your property, then you're losing out, right? Because you have no deposit essentially to take it from. But I've seen it from both perspectives, is all I'm saying.
Well, legally, the position is that you should be paying your rent in full, even the last month. And then you should, the deposit, like I said, is supposed to be a deposit that was not spent by the landlord, by the way. Let's remind landlords.
And that's the thing.
Not spent by the landlord already.
Legally, the landlord should give you back your deposit, and they should not be taking out for wear and tear. They need to understand that if someone is living in your apartment for 5 years and they move out, you can't be docking them for every repairs that you need to make in order to rent it to someone else, because after 5 years, there's going to be wear and tear. But they don't do that. A lot of them, I've experienced that more than once. And I consider myself to be a good tenant.
Yeah.
And I more than once I didn't get back either my full deposit or none of my deposit.
Yeah.
And who's gonna take someone to court for a couple $100?
Right.
I mean,
yeah, and I think again, this is where a tenancy board would be extremely helpful. If we had, dispute resolution options that were easily available to people. But no, I completely agree with you. And I see both points as well. But in terms of the law, I just want people to understand what the law says. And hopefully people will operate within the remits of the law. So thank you so much, caller. Appreciate the contribution as always.
Thank you.
All right, my dear. So yeah, I mean, if you're a landlord, you need to know what the law says. If you are a tenant, you should also be aware of what your rights are, but also what your obligations are. Because it's so funny when it comes to law. Everybody's like, oh, I have rights. I know my rights. Fair enough. Okay, not a problem. But you also have to know with rights come the opposite side of that, which is also obligations. So as a tenant, there are things that you can and can't do. As a landlord, there are things that you can and can't do. And so, you have to know both sides of the coin to be able to operate properly. All right, let's talk about Hurricane Milton. Now downgraded to Category 4 storm, but still an extremely powerful storm. So please, folks, be mindful of that. If you're in Florida, you want to make sure that you have gotten out of the way of this storm, because this is still going to be quite a catastrophic storm. Simple C says work contracts suck. Why do people have to give the employer 2 weeks notice before they quit? But an employer can fire us on the spot without 2 weeks notice. So that isn't entirely true, Simple C. So let me tell you what what your employment rights are now. And again, make sure you make reference first to the labor law. So the labor law sets out the minimum standards by which employers and employees have to operate, right? You can contract out of that in the sense that you can offer more. You can't offer less. And I see a lot of people thinking that contract out means that they can do something that the labor law doesn't permit. The labor law doesn't permit you to do certain things. So the labor law says that in all circumstances, a certain notice period has got to be given. You can't give less than that notice period. You can give more, but you can't give less. So the labor law is like the baseline that all of us should be operating when it comes to labor rights and stuff in this country. However, Simple C, there are circumstances where you can be what is called summarily dismissed. And that's where no notice period at all is required. And you can understand this, right? You work for someone and you commit certain egregious, in terms of an employment contract, certain egregious offenses. And that's subject to interpretation. But there are things that definitely would be egregious, like theft and insubordinate behavior. Things that basically the employer is going to say, listen, I can't have this person employed with me one more day because of what they've done or because of their behavior. If they've already gotten warnings and stuff like that as well, you better believe that they can terminate your employment contract with no further notice. So it depends. Generally speaking, if you're trying to end an employment contract and it's not related to behavioral issues, theft, dishonesty, insubordinate behavior, whatever, you still give notice and you are entitled to notice period. However, if the employer does not want to give you notice, even if you haven't technically done anything egregious, they can put you in what's called gardening leave, where you're still working for them and they're going to continue to pay you. So say a lot of companies do this with their executives because quite frankly, they don't want the executive in the office because then you have access to information that could be sensitive to the organization. I think the HSA did this not too long ago with one of their top level executives, directors or something. He left the organization or he was leaving. Sometimes you're the one who resigned. And you say, okay, employer, I'm going to give you 2 months notice, 3 months notice per my contract. And they're going to say, you can leave today. Pack your little box of stuff and leave today. We're going to put you on gardening leave. That's simply because they don't want you in the office. Lawyers do it all the time. Sometimes doctors' offices and stuff will do it. A lot of times there is an element of bad blood there that, they still can't terminate you on the spot for, or they have concerns that you might just have access to like client files or confidential industry information or whatever. So they're going to put you on gardening leave, which means that they'll continue to pay you as though you were working, but you're really not working, right? And gardening leave, some people do 3 months, 6 months, whatever, and they'll put you on gardening leave. And then they've accepted your notice, put you on gardening leave so that you no longer come into the office and technically you're not working for them. The other thing that they can do is they cannot give you notice and pay you in lieu of notice. So simply see, the law does permit people to say, we're terminating your contract and we're terminating you today, right? Your employer wants you to go, but we know that the law says we're supposed to give you a month's notice. So in lieu of that month's notice, we're going to pay you for the month. So there's a financial out. So they don't want you coming to their office. They don't want you coming to their retail store and working for them. So they pay out the remainder of that notice period. And that's called, basically a payment in lieu of notice, right? So instead of the full notice period where you sit there and you continue to work for them, they're going to pay you for that period and say goodbye and cease the relationship. And notice that the opposite doesn't happen. So there's nothing in law that requires an employee, even if the employee says one day, I'm not coming back to work after today, there's nothing in law that forces them in any way, shape, or form to have to compensate an employer. And a lot of employees do it, and it's really quite a detrimental situation to the employer as well. Scott says, anyone that ever rented 6B Stewart Lane can tell you that they're not getting the deposit back. Thousands from multiple consecutive tenants. Where's 6B Stewart Lane? What district is that? Very specific here. 6B Stewart Lane. Maybe you just need to give us the name of the landlord because you've already given us the address, honey child. So which landlord is not giving people their deposit back? Oh my gosh, I'm so sorry. Look at me. Making a mess of my oatmeal, honey child. Leroy says, bring me a 2 for $6 now. 2 for $6 what? What's that? All right. Let me see. Thank you. Morning, Siobhan. Oh, Strong Wilt says, good morning, Sandy. I wanted to do a shout out to Dr. Sanjeev and Dr. Ramesh. They're also two very good doctors. They are the best. All right. And big shout out to Dr. Naranjan. And oh gosh, I forget the other gentleman's name. He's also on the orthopedic side. I saw him this week when I went by about my neck. And he gave me some very good exercises. I've been trying to remember to do them now. All right, folks. Hurricane Milton. I saw a question here about additional flights by Leanna. Honey child, the airport is closed. You ain't going nowhere now. We told y'all yesterday, Cayman Airways put on an evacuation flight last night. We think about 85 people took advantage of that. You needed to get out while the getting was good. Cayman Airways cannot fly into an airport that's closed. And they knew ahead of time that the closure was happening. Mm-hmm. And that's why I told y'all that it was happening and encourage you to get out. I heard people messaging me talking about, Sandy, my Amazon package not come yet. I would think I won't come on Wednesday. Honey child, you can't not be serious. The Tampa International Airport, North Cayman Airways is going to be waiting on you or your Amazon package. So you better hunker down now. Mm-hmm. I'm just trying to hurry up and eat it before it gets cold again. Y'all better hunker down and ride out the storm now, because that's it. The earlier flight was closed. So yes, 9 a.m. this morning, the airport is officially closed. Boy, what a storm, honey child. It's now downgraded to a hurricane. Let me see here now. Hurricane 4, I think, as of this morning. Some news reports are still saying that it's a 5. So regardless, 4 or 5, it's extremely powerful. Hospitals urging emergency steps because they're looking at IV fluid shortages after Hurricane Helene. Congress is preparing. Sorry, not Congress. FEMA is preparing for worst case scenarios and packing some 165 miles per hour. Let me just try to see if I can get the latest on this hurricane. Give me 1 second here. Some reports is that it had gone down just a little bit. They got Hurricane Milton cameras already looking out. Yes, tracking now. Okay, let's have a look here. This one. So, Floridians, Tampa area, please get ready for the storm. That is your best case scenario. Let me see here. All right. Yep. Oh, Tampa is such a nice city. I love Tampa. Makes me wonder why I didn't go there more often. Hurricane Milton, 1 second. Okay, so I know the Caymanians in Florida group, everybody's obviously watching the storm very, very carefully. And just trying to see here. So as of 7:41 this morning, so this is the 8 o'clock, this says all of South Florida is now under tropical storm warning through Thursday at 8 a.m. So that means that pretty much the entire state, all the way down Everglades City, Miami, Fort Lauderdale, Boca, everybody is looking at wind gusts of 34 to 70 miles per hour across the region. Let me bring up this little map for you guys here so you can see what I'm looking at. And there we go. So that's what people are looking at. Thank you, Diamond Princess. Now we got category 4 storm, but still anticipated to be very, very, very dangerous with significant storm surge and threat to most of Florida as well. So, yes. So hurricane watches and storm surge warnings remain in effect for Southwest Florida. And a watch again means that hazardous conditions are going to be possible within 48 hours, but uncertainty still remains. Warning, For those who are 36 hours outside of the cone, the U.S. National Weather Service, they've got Miami, Florida division. They have said an hour ago again that all of these warnings are in place. So asking people to please prepare accordingly, reminding people of what all the different watches and warnings and stuff means to them. Okay, so downgraded slightly, but I can assure you it's not much of a downgrade. So, don't let that give you any comfort between a category 4 and a category 5. Strong was talking about, I had them laughing about the pack. I'm telling y'all, they're like, oh, I'm still waiting on some packages, Sandy. I'm like, you and your package both are about to get blown away, honey child. So I don't know what to tell you, but I wouldn't mess with that situation. Amazon, listen, Amazon is amazing with packages. They can replace your package, honey child. Don't you worry about that, but you stay there and mess around with that storm and lose your life.
Of rainfall. This is going to be some catastrophic freshwater flooding along with coastal flooding as well. The surge, again, going to be the worst just south of the eye. So what you need to know at this point is that you have to heed all of these evacuation orders, please. Again, the timing for these impacts is going to be starting up Wednesday at 6 p.m. That's when things really begin to go downhill. Isolated tornadoes are possible too, up until 6 a.m. Thursday morning. Manatee and Sarasota, look at this, guys. We see that 4 p.m. till 4 a.m. on Thursday, potentially even a little bit longer than that. We have those winds topping at 110 miles per hour. Rainfall could be up to 10 inches. Storm surge could be the greatest right here because this would be just south of where landfall is supposed to be. We anticipate that landfall over towards Anna Maria, just north of Bradenton there. So just south of the eye of the storm, that would be the worst surge at 11 to 15 feet. So you need to heed all the evacuation warnings at this time. Water vapor imagery. I want to show you guys another thing. The one key piece of positive news we've been talking about is the wind shear and also the dry air. So here's the dry air itself to our north. You can see all of the orange here. This is the system, and you can see it's a category 4 strength. It's undergoing the eye wall replacement. It's reorganizing itself. So as it gradually travels to our coast and tries to make landfall, this dry air is going to come on down from the north, and that's going to help to cut off this system a little bit and to weaken it as well. And so that's exactly what we want to see. However, we can't focus in on exactly what category it'll be because the wind field is so large with this system, very similar to Helene. There's going to be a lot of wind damage with this system. So once that eye wall replacement happens, you get a brand new system that's going to be bigger, wider, and more powerful, right? So the eye wall, right, it comes in and regenerates itself. And so the wind field that we talk about, these are all the winds around the system, and they become much wider and much stronger as well. So we're going to see a lot of damage with these winds too. And that's for the entire state, not just for here on the West Coast. Again, they're going to be impacted by these windy conditions and all this rain as well over towards the East Coast too. Now, what we do know with a lot of these systems is that we could have the potential for isolated tornadoes that I alluded to before in the impacts. So here we go. We already see that low end risk starting Wednesday for the isolated tornadoes, Thursday as well, as we will be receiving those bands of rain and wind. That's where those isolated tornadoes could be located. Look at the graph as well, showing us our in-house model that this wind is no joke moving in. And these are just the sustained winds. These are not even the gusts, the highest of the winds, but already showing 60 to 70 miles per hour. And those gusts could be well over 100 miles per hour. Rainfall, what you can expect for our area, anywhere from 10 to 15 inches even is possible. Most of us will see anywhere from 8 to about 12. Isolated pockets, 15 inches of rainfall. So right now, what I need you to do is take these evacuation warnings seriously. They are mandatory for a reason. Please, you have time to get out right now and to make sure you get in your safe spot by tonight. Now, once you figure out where your safe spot is, where you're going to ride out the storm, before you get there and set up shop, make sure you have everything in your kit and everything that you need. today, we want to charge up all your devices, have your portable chargers on you, battery-powered fans, another great option. Check your kit for all of your documents, important things that you need, your medications. You want to make sure that if you can find any gas, it's scarce, but it's out there. Make sure you gas up while you can. Stock up on the water, and then make those last-minute preps to your home, and then you gotta go. You need to evacuate. So guys, for now, that is all I have for you. We're going to continue to give you this special coverage. We're going to be here for you every single step of the way, myself and the rest of the 10 Tampa Bay weather team. We're watching the system carefully. We're going to give you the latest on everything that you need to know, but now is the time to take action and evacuate in this moment in time. And we have a special edition of 10 Tampa Bay this morning coming up at 9 a.m. where we will investigate and dissect the storm even more so and tell you the exact timing of everything you need to know. And we'll continue to keep you informed, prepared, connected, calm, and most of all, safe.
So there you have it. Again, a little bit of weakening of the storm, but it's still, still got plenty of time, as she rightfully said. There's a real possibility that the storm could reformulate and, get stronger, or maybe even go down to Category 3. But the massive size of this storm, again, posing risk to everyone, basically, in most of Florida. I mean, look, it's the storm is literally projected to cover in some way, shape, or form, except maybe north of Tallahassee. What is this? Mobile de something? I don't even know where that is, at the very tip on the border there, all the way at the tip of Florida. They may be spared, but it looks like this is going to just go over the entire state of Florida as a pretty massive storm. So everyone, even down to the Everglades and Miami area, expected to get some impact from this as well. So do your necessary preparations. I did see yesterday that some people were actually running out of gas because of the extensive, highway traffic. These portable chargers, it makes me wonder about the electric vehicles, if they have chargers along the way, because people are basically getting stranded on the roadway because they hadn't anticipated that it would take them that long of a drive to get to safety. So yes, it is. That's exactly what's happening, folks. We want to encourage everyone again to listen to your local news sources in Tampa and take all of those, warnings as seriously as you possibly can. Wow. What a mess. Quite something, I would say, for sure. Nothing to joke around with. All right. Let me just check a few things here. This is what it looked like yesterday in Florida. People evacuating. Most people definitely listening to the warnings and moving out. That was I-75, and hold on, let me give you the exact location there. But this is good news. This is what you want to do when they're telling you the storm's coming, and it's no joke. The best thing you can do is secure your homes and get out. Then that is definitely the best advice. Land and homes can hopefully be replaced, but your life cannot. All right, so please, folks, just heed the necessary warnings. So this was I-75 between Morris Bridge and Bruce B. Downs. Again, experiencing significant backups. I-275 northbound heading into Pasco County was also seeing heavy traffic with significant slowdowns starting at 275 and Livingston Avenue. So all of that, if you're in the Tampa area, you'll know all about Bruce B. Downs and where I-75 is. But the bottom line is, it looks like a lot of people are listening and they are getting out of the way. Masu says that's how South Sound homes got washed out completely by the huge sea surge in Ivan. You got multiple things at play here. You've got storm surge, For some people, it's going to be a combination of, storm surge, things like freshwater storm surge, the ocean potentially. And you also have other surge happening where, you've got bodies of water, lakes and rivers and whatever that are going to be rising significantly as well. Tornadoes, this is something that we often don't think about when we have a storm here, although we get the occasional tornado here, but most of them tend to be out on land, but out in the ocean, my apologies. But tornadoes can be, kicked up by these storms as well. So that's something else that they've got to think about. And, other things, just really, really severe weather. So you want to try to avoid this if at all possible. All right, let's talk politics for a second here. So the Parliament was back in session yesterday. There was some debate going on with about what's coming up on the referendum. People have, obviously taken their positions on this. I must admit that I didn't actually listen to the proceedings. Okay. All right. So all of South Florida will feel Hurricane Milton, says this person. Yes, thank you so much. So I didn't listen to all the proceedings, but the one thing that was done earlier on, which we saw beforehand, before the real debate started, is that the progressives did finalize and formalize their change in leadership. Now, the only thing that was interesting about this is that, quite frankly, we obviously knew that the new leader was Mr. Joey Hugh taking over. I mean, this was the years in the making. Nobody was surprised by that. We would have been surprised if it didn't happen, honey child. Remember now, I told you guys during the last election, there was a real pull for power in the party. He wanted power, and he wanted the premiership specifically. And he was willing to fight for it. But one thing you got to give the PPM some degree of credit for is his people, the leadership at the time, said, all right, Joey, we know you want to be premier, but your time will come. So let's give Mr. McTaggart one term. Given his senior years, he probably wasn't that interested in doing more than one term anyway. So they said, let's give him one term as premier. He goes down in the history books as being premier number whatever. And then you'll be next. Well, he never got to be premier because the PPM didn't take the government. So he became leader then of the opposition, right? Now, going into the next election, so this would have been coming up now in the end of his tenure, the PPM, or the progressives as they call themselves these days, trying to invigorate themselves and make you believe that they are a reformulated party and, under new, youthful, young leadership, and that therefore you should vote for them and give them your support. What's up, Doc? Not so sure about that. Oh, we're in overtime. Bye, radio folks. Catch us on the social streams. So I don't know anything about that part of it, because I don't think there's been anything that Mr. Joey has done that would make you go, yeah, he's different than what was already there. We can expect great things from him. It's the same playbook and, the same rhetoric, quite frankly. What is interesting, though, is for me, I found most interesting the fact that Barbara Connolly accepted the position as deputy leader of the opposition, especially since she has been telling people that she has no intentions of running again in the upcoming election for 2025. So I was shocked yesterday. I'm thinking to myself, why would she accept? Now, y'all can help me. You can help me understand this if you understand it. she's been telling people that she is done. She's retiring from politics after, a number of years now. And she is not going to be running in the political circles for her constituency. And I'm thinking, all right, some new blood finally for at least part of Windsor Park. Why then accept this role? Well, there's two possibilities. The one possibility is that she is going to be running again. And I've always said that, listen, this decision is less up to Barbara than any of us think. Now, I'm not trying to say that she is a prisoner to her political, what are they, colleagues? But yes, she is. There's been a lot of things over the years and a lot of examples of Barbara not demonstrating or exercising her free will as though she doesn't have any. It's unfortunate because she's the only elected female member of the PPM. Do they have anybody else? They don't have anybody else. And so I think for her, she's probably in a very, very difficult position between a rock and a hard place, as Caymanians would say. And then I also think it's a matter of the dynamics of the party and personalities as well. She has not had a particularly strong personality ever in politics. She ran for politics because Kurt Tibbetts told her to run for politics. Simple as that. So I'm going to let the cat out of the bag today. Where's my little bag? Let's pretend like this tissue box is the bag that I've got of some political secrets. And I'm going to let y'all know what's going on in the world of politics. Okay? So let's whip out the first one. Honey chill. So Kurt Tibbetts said, yeah, you're going to run. And, I think I can get you and what's his name in, although I'm no longer running myself. He was able to get certain individuals elected. And Kurt Tibbetts yields a lot of power politically, and especially in the Georgetown area. So that's how she got into politics. I don't think Barbara ever wanted to be a politician. She's involved in the PPM, whatever. She's got some personal relationships with these guys where they have a lot of influence and power over her. So having said that, when she said the other day that she wasn't intending to run again, I said to people who were telling me this, I said, wait till nomination day. There are lots of people who've said, Juliana O'Connor-Connolly claims that she's not running again either. We have the video clip. McKeeva Bush claims that he's not running again either. We have the video clip. Those two, I know for sure, are lying. Okay. McKeeva, he just pretend like y'all never heard him say that and that y'all have amnesia and he's going to run again. Julie's going to use the Jesus card. And I'm going to say it's divine intervention why she should run again because God told her to run because she still has a lot of work to do that in 30 years, she's not been able to accomplish a single thing. She's going to tell you that, oh yeah, she's still going to try to fix education. So they're going to run again. And I dare say after this move yesterday, I also believe that it's highly likely, I would say probably a 75 to 80% chance that Barbara will be running again in the election. I don't know why they do this. Why do they lie? Just keep your mouth shut. Like, we don't care, Anyway, so she has actually become the first female leader of the official opposition, which is congratulations, Barbara, I guess, on that front. And yeah, so there she is working with Mr. Joey Hugh now. Speaking of Kurt Tibbetts, and I do have a comment that has come in from one of our listeners about yesterday's proceedings. But speaking of Kurt Tibbetts, I understand his daughter, he has, I kind of feel a way about this. I'm going to be honest with you. I don't understand why former politicians feel like they have such power that they can then bring in their children and in-laws and say, oh, vote for this person. I'm no longer in politics, but you need to vote for this person. This isn't a kingdom of like, okay, the royal family, we're the royal family. And so it's like a succession plan where the next in line is going to become, the next king or the next queen or whatever. Politics in Cayman is starting to feel a lot like that. When you have former MPs pushing their children into the world of politics. And where's my back scratcher? And saying that they are heir apparent, I guess, in the political arena. So I've gotten it from very, very good sources. His daughter, who seems like a lovely young lady, but I've never seen her in a political community sense, that apparently she will be running for political office. Jeanette, I believe is her name. Jeanette Tibbetts. So that's going to be interesting. And on good authority, I have it that she will actually be running in Red Bay because Alden is coming out of Red Bay. Now, my sources have also revealed that apparently she's not too keen on the progressives. And so she would probably be running as an independent candidate or potentially with some of these other groupings that are slowly gaining steam and coming together. Now, wouldn't that be interesting? Because what that means for Kurt Tibbetts himself is that he is going to have to pull away from the PPM, a party which he was instrumental in starting. The first leader of the progressives, the PPM, was Mr. Kurt Tibbetts. So I'll keep you guys updated there. That is a very, very interesting development. I'm sure that's news to a lot of you, and you probably had not even heard that before. Now, what else am I hearing on the Mall Road? Yes, Miss Jean, she definitely gets pensioned. The one question I have about the strong will, Heather's not, she can get elected with the progressives. Her and Wayne Panton ran together as independents. But the other question I have is, does Miss Barbara Connolly still hold her full-time position with the company that she was with? Because remember, all of this time, Barbara has been working with this company. Is that something she would have had to declare on her declaration sheet for Parliament? Does anybody know if she's still working with this company? Because I don't really know how she would find the time to do that. Always found it egregious that she was even holding this job to begin with. You work for the people of the Cayman Islands and you're making a pretty decent salary. Why on earth would you need anything else? I'm just saying. Explain it to us, because we certainly don't understand. Now, why is this portal? Why is the, where can I go and find the register of interest portal? Declaration instruments. Can we just see the declarations? Why do they always make this stuff so difficult to find? All this should be a matter of public record. But does anybody know if she's still working with this company management firm that she was working with? Or has she finally resigned? Because she is under Miss Julie. Miss Julie has promoted her. She is some kind of permanent secretary or not permanent secretary, but parliamentary secretary or something as well. So there's that big question that I have that, quite frankly, I don't have the answer for. All right, Joey will have Caymanians outnumbered with permanent residency and work permit holders 4-1 his first term. Well, honey child, the PPM has had a track record of not thinking that Caymanians are very valuable other than being messengers and receptionists, in the words of Alden McLaughlin himself. Strong Wilt says Kurt Tibbetts is still running the show. They get advice from him. Well, I think he has a very lucrative consulting business now. This is what ex-politicians do. And yeah, so that's where we're at with that. So let's read this comment that came in from one of our listeners last night after they saw this announcement. They say, we always demand Caymanians to be qualified for employment opportunities, yet the PPM have appointed 2 persons with 0 qualifications to lead their political party. If they're not in politics and elected to office, the only other jobs they could get are working for family-owned businesses. Joey, Hugh has no formal education and professional qualifications, no O-level passes. He did not qualify for sixth form and A-level studies. He didn't? Oh my God, that's news to me. All right, let's continue reading. Did not complete his associate's degree in farming studies from Santa Fe College in Gainesville, Florida. Farming studies? Is that a real degree? That sounds like one of those fake degrees. That sounds like basket weaving or something. All right. He has no professional vocational qualifications or certifications. What makes the new leadership of the PPM qualified to potentially lead a country like the Cayman Islands? Wow. That is a scathing question. Now, I mean, I didn't know any of that about Joey. That's, I'm going to be honest, that's news to me. There's such a thing as farming studies. I mean, I know that there's what is the name of the organization again? AAA, the American Association of Agriculture. I don't know, but remember we had them in high school when I lived in the States. There was farmers something. I don't know, triple something. But you kind of join if you're interested in being a farmer. But I didn't know that Santa Fe College in Gainesville, Florida. Well, Gainesville is a little bit country. They actually had a farming studies. Okay. And he didn't complete that. Lord Jesus. So this person says he has no professional or vocational qualifications or certifications. You know what gets me, though, is the fact that, all right, everybody has a different path in life. And it says he has no O levels. He didn't qualify for sixth form and A levels. Okay. Maybe not. I mean, I don't know. How old is Joey, by the way? I don't even know how old he is. But my question is, why hasn't he done anything for himself since then? I mean, he's in political office. He's making good money for sure. For many, many years, he could have gotten by now a friggin' PhD in something. Basket weaving, doesn't matter. But I do find it interesting that these are the same people who want to get up to our young people and say, prioritize your education. And yet they themselves has demonstrated that they haven't done that for their own benefit. How much do they really value an education? It doesn't have to be a 4-year degree. It could be anything. Listen, I told y'all I'm doing some studying right now. Honey child, the brain, after a while, gets so used to not studying. Oh my God. Y'all got to see my homework. Where's my homework stash? I got a whole pile of materials that now I have to be reading and forcing myself through. But yeah, by the way, I haven't forgotten the homework assignment. Y'all think I've forgotten, We're supposed to do that on Friday's show. Nope, not a single person reminded me, but I'm coming for y'all this Friday, so you better read up. So I guess, I think Miss Barbara has, I don't know if she has any qualifications per se, but she does have experience in the corporate world as like a corporate assistant or something like that. So I don't know. John LaRue says at least Joey has a hot wife, as though that has mattered to him. I'm just saying. In practical terms, that doesn't stop certain men from doing whatever it is that they want to do. So is that a benefit to him or to her or who? That's not going to help the country with him having a hot wife. Miss Sue says, Joey Hugh, OMG, no way. She didn't seem to know that. Damn Greedy says, strong wilt. Miss Barbara, have a good day. Jim says, could be horticulture. Oh, yes. Thank you, Jim. Future Farmers of America, the FFA. That was like a club from when I was in high school in Tampa. Very, very good. So maybe he wanted to be a future farmer of Cayman, but you got to finish that farming degree, which I didn't know he was even doing. Yeah, horticulture, that's a real area. That's a real specialty. So no doubt about it. He could have gotten his degree. Scott says, well, the current premier had like 300 people vote for her to a population of 80,000 plus. So if Joey beats that mark, he'll be more legitimate than the current situation. Oh, Scott, I gotta love you. Very, very logical indeed. I was saying to an elected member the other day who happens to also be a minister, I was saying to them, I said, here's the joke about it. If we had an election today, this is just me, right? If we had an election today, I believe that the person who would come in with the highest numbers, okay, of all elected officials would be Mr. Wayne Panton. He would have the highest numbers. If we had the option to select the premier by popular vote, that means we the people get to vote for who the premier would be, it would also be Wayne Panton. And I said, if we had the opposite vote, the least likely to be voted by as premier for the people, it would be the current premier, the Honorable Juliana O'Connor Conley. The popular vote doesn't want her where she is. And to Scott's point, she gets elected by 300 people, and that's enough. Hold on. What was it? That was 2021 election. Let me see if I can find the exact number of people that voted her in. So, I mean, that certainly says a lot. I agree with Scott. When you think about that, that's kind of shocking in a way, right? She's the least likely person that any of us would vote for as it relates to being premier of this country. And yet there she sits, making all of her lives incredibly unamazing. Let me see how many people voted for her. North Side, East End, Kim and Brack. Not even 300. She won by 266 votes. Total people the total ballots for Kim and Brack East was 373. So she won with 71% over Mr. Elvis McKeever at 266 votes. Less than 300 people voted for her. Shocking. Absolutely shocking. Oh my God. Let me clutch my pearls if I had any, honey child. Lord have mercy. This is a hot mess when you think about it. Wayne Panton had 655. And he had way more people running. There was a total of 4 people running in that constituency. So that's where the vote gets all split up. But he still had way over double what she had, honey Jew. What a hot mess. All right. Let me see here. What other political secrets are coming out? Oh, here's another one. John. Strong Wilt says, and can you imagine that he wants to be premier? Speaking about Joey. John apparently is going to formally, this is what the streets are talking. John is going to formally join up with the progressives. Poor them. They've got to be extremely desperate. I'm sorry, but what? Last time they ran, if my memory serves me correctly, about 7 people in the election. Do they have more than that? I think that's what they ran. They couldn't get it together, nowhere near 19. This time they're going to have the exact same issue, except they're going to have certain people come in and join them. So my sources are telling me upon the streets that John is coming in hot and heavy to join up with them. And also that, oh gosh, what's the other name now? Juliana O'Connor Conley, well, she never left the progressives. All this time she's been a progressives member. She again will be joining with them during the election. And somebody else. But definitely John is going to be, like I said, it's not like he's jumping ship. He's worked with them the last couple elections anyway. So, but it seems now he might actually formalize it. Royal bank robbery sentencing this morning. Oh, shoot. I totally missed that. Oh my God. Is it this morning? Mel, now you're telling me? You should have told me earlier. All right, I'm going to get my people on it. Hold on. Let me see here now. Uh-oh. Oy. I got to go. All right. Anything on Scotland? Which Scotland? This person says, hi, Sandra. In regard to the topic of having qualifications / degrees, I could not disagree more. What degree does Bill Gates have when starting Microsoft? What degree did Steve Jobs have? What degree did Richard Branson have? And what degree did Mark Zuckerberg have? What degree did Michael Dell have? To be sure, education helps, but you can be sure that there's such a thing as an educated fool. Common sense is a gift. It can't be learned. Having said all of that, those people were actually in university. The vast majority of them might have dropped out because of a business opportunity, but it's not that they didn't have the academic smarts. In fact, these people are very, very brilliant on so many different levels. They're like nerd certified. So they may have dropped out to pursue other avenues, but it's not that anyone is saying that they didn't have qualifications. Now, I'd have to look each and every one of those up, but I think Mark Zuckerberg actually has a proper education. I can't tell you, hold on. He was in college when he started Facebook, but he was a computer programmer and co-founder of obviously Facebook. He went to the Phillips Exeter Academy, enrolled in Harvard University, and yeah, he's pretty smart to even get into Harvard. I think what this person is saying is that these guys are still smart. I mean, I could look all of them up, and you'd see that it's not that they didn't have, to this person's point, they weren't just talking about a university degree. They were saying there's no O levels, there's nothing that would allow you to think that, he would be successful with the management of a country. And even, they went as far as saying he wouldn't even have a job if he didn't have a family business. That's different. I mean, these people, somebody, they formed companies and stuff like that. They set Steve Jobs had started, let me see here now. He actually, in 1974, he was that old? He was at Reed College, 1972. And then he did eventually drop out to start working at Apple. So he didn't complete it. But again, certainly brilliant in so many different ways. Okay. And he, let's check out his yearbook, his high school yearbook. Long hair, boy. He was a rebel. So, yep, he was doing coding and all sorts of stuff. Apparently this Reed College that he attended was a very expensive school that neither of his parents, it says, could afford. So he somehow managed to get in for one semester. All right. But yeah, I mean, listen, a formal education it isn't even about the formal education. It's about the things that you learn, I dare say, along the way. And common sense can actually be taught if you believe in the world of logic, but you have to be open to it. Gabby, I saw that documentary. Marlon was actually watching it this weekend. I didn't personally get time to watch it yet, but I will. Leanna says, and yet people will still vote for the PDOs and adultery back in, laughing out loud. Strong Wilt says, what's wrong with John? He's just flipping and flopping all over the place. He's taken from Julie's book and Mr. McKeever Bush. You go with whoever's in power, or so they think. I think the kids that win the annual Best Lemonade Stand get more than 266 votes, says Scott. There's a difference. These people run their own company and they were in university. They didn't run for office or president. Such a bad comparison. Well, not only that, to this person's point, I mean, look at Donald Trump. He's not really an educated person either. He only got through university because his father had the money to pay somebody else to do his homework. So yeah. All right, let me run to court and see what I can get, what source I can get for y'all. This person says, and they were intelligent individuals who were all in university to begin with. So, I mean, there is a difference between someone who has no qualification and no intelligence to go with it, versus someone who, you know, can't even get into A levels or whatever. So this person's like, lie. Kurt daughter is going to run. The thing for power, the thirst for power is real. The 4-H club. What a mess. This person says, say what? Joey has no qualifications but wants to be premier? How much lower can the bar be set? Do any of these donkeys besides Ween have an education? Yes. Did you not hear Juliana claim that she's a lawyer and she could have been a partner one day? Well, we don't know anything about that, honey child. Coulda, woulda, shoulda, but we'll never know now, will we? So yeah, some of them do. I mean, Mr. McTaggart is a professional in his own right. Who else? Barbara, nope. Mr. McKeeva, nope. Oh, Lord. Andre, professional. And apparently, here's another bit of sus for you all. My sources tell me that Andre is vying for premiership. So this is a whole thing now, honey child. Everybody, everybody wants to be premier, and you know, there is rumors afoot that is happening. What a hot mess. Let me see. What else? Oh gosh, so many questions. Morning. None of the members has any education, just a high school degree and a little pocket money. Not all of them, but I'm trying to think. Somebody said, well, Sandy McKeeva didn't have any either. Not a PPM or UPM or any, but Joey got a little more than McKeeva. What a hot mess. I'm trying to think who else is in there that's educated. Chris Saunders has an education. That's an example of where an education isn't going to really help you have a moral compass. So there's a difference between the two. I heard Alva Saku is coming back out again, and he's going to be joining up with the progressives. Alva, call me, because you and I need to talk about why that's probably not a good idea. I'm just saying. Call me. Aren't you doing articles or something now? Don't make these people push you into politics again and mess yourself back up where you have to start all over, honey child. Oh my God, what the fuck? Oh, excuse me. Somebody said, well, Quincy's back on the brack, loitering by the store, back on his bullshit. Well, that didn't last for long. Somebody says Big Mac is a doctor. Doctor my left monkey cheek. Oh my God. She's working because she know that she just a placeholder for PPM to vote how they say, but doesn't actually need to do anything for the country. Oh, you mean Barbara? Extra sauce right there, honey child. Thank you for that. Somebody says CIG has been spending millions of dollars every year giving Caymanians free tertiary education to all sorts of institutions. And look, none of our MPs are taking advantage of it. Oh, yes. Kathy Wilkes does have a law degree as well. She wasn't really practicing or anything. I think she was trying to do articles. Let me think about it. Anybody else? Nobody from the north side, east end, coming down, Bawden Town. Joe definitely got not on. Saunders has a degree. He's a CPA, I think. Who else is in Bawden Town? Heather, nope. Wayne Panton, yes. Coming up that way, then we go to Prospect. Alden McLaughlin. So Alden was obviously an attorney, a partner in his small law firm. Sabrina, I guess she had her nursing qualification. I don't know academically what comes with that. And she was a business owner. That's Red Bay, Prospect. Then we go into Georgetown. We had Roy McTaggart, Joey, nope. David, nope. Not at all. Working for family businesses again. Fortunate for them that their families had a business. Joey, nope. Mr. McTaggart has some education. Then we go, that's Georgetown. Then we start to go west Bay. Kathy has a law degree. Andre is professional. He worked in the civil service. I'm thinking Andre probably has at least a bachelor's and a law degree. And McKeeva, definitely not. And who else is in West Bay? Oh, Bernie. What does Bernie have? Does Bernie have anything? Does he have some sort of sports qualification at least? Simple C says Andre for Premier. I'm sure Andre would love to hear that. But yeah, there's going to be some real fighting for the premiership. So listen, of all of the groups that are out there supposedly, talking and forming and getting people on board, some of them don't have the traction that I thought that they think that they would have had. They're not going to get 19 people no matter what they do. So do you have half a group? Do you put together a group that still is only going to come out with like maybe 7 or 8 people at best? Or do you just have those people run as an independent and then see what happens? Lots of questions to ask, but apparently I got to go to court. So I'm going to grab my laptop and head out the door, y'all. Thank you very, very much. All right, let's go ahead and end the show. Let me see here now. There's a new feature here where, hold on, I'm trying to look for it. What a hot mess. You know what I've realized? Hold on one second here. Oh, that only does the first. Okay. So yes. So apparently, we'll have to wait and see how some of this pans out. Of course, y'all know the deal. Y'all aren't going to get any election news anywhere else like you will in CMR. So we got you covered. All of the official sus, the unofficial sus. I know a lot that's happening behind the background. Sometimes I can't tell you all of it just yet. Still fact checking and doing some questioning and trying to figure out some of what is going on. But we'll get to it. Don't y'all worry about that now, honey chill. We'll get to all of it and you're going to get it first. CMR, your 2025 election headquarters. I'm so excited about the election. I'm so excited. Starting November the 1st, when we are back, which actually I'm away. I want y'all to remember now I'm going away. So I will be back on, the 1st is a Friday, not that day, but on the 4th, we're going to start our in-depth election coverage on all of the issues, all of the topics. We need to look at the questions on the referendum and we need to dissect those. We're going to spend some sufficient time on the whole marijuana issue, gambling, and of course, definitely the Cruz birthing. So get your opinions, your research done, your questions, your opinions, your facts, most importantly, and we'll get it going. So Andrew says, straight from the kitchen, hot. Yes, sir. Andrew also says, wow, everybody's fighting for power, not for the people making their lives better or for the people who elected them to serve. Oh, honey child, how you know so good, Andrew? They fighting for all the wrong reasons. Anyway, y'all have a blessed day. See you guys tomorrow morning.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.